Hello, this is Shadi Reyes. This is CVI 2018. With me is Iyad Azzam. He is the finalist for the coronary challenging cases. Congratulations, Dr. Azzam.
Thank you so much.
Dr. Azzam, coming from Kearney Regional Medical Center, and yesterday he presented a very challenging case in coronary. Can you walk us through it, please?
Sure. So this gentleman was in his 60s. He had history of bypass surgery and multiple interventions in the past. He underwent an attempt at an intervention of a closed artery on the left side, it's left circumflex, but no balloon would cross. So he was referred to me after several weeks. So I was able to advance multiple wires. Then I started doing atherectomy using growth ablator. It was a 1.25 millimeter burr. 3 passes were very successful. The 4th got stuck inside the artery. And we tried multiple things, you know, we advanced multiple balloons, we got a contralateral access, still trying to get the burr dislodged. It didn't work. Then we disassembled the device. We advanced multiple catheters over this weak wire, still no success.
What catheter do you use, like a guide liner? Or?
I used a guide liner, right, and tried to pull it out. Exactly, it didn't work. Of course, a surgical consult was called, but you know, the surgeon said, just continue your work. So we did. Basically, what I did is I needed to upgrade the system for an 8 French, despite the fact I don't have any backup in that groin. So I used an 8 French 11 centimeter sheath, and used brought an 8 French JR4 guide that I had to cut almost 20 centimeter off. Then in a telescope fashion, I advanced a multi-purpose guide 6 French and a guide liner over the rota system and a J-wire. So I advanced everything and then pulled some equipment out. I was able to then advance a body wire and then a balloon, inflated them in the circ to anchor them, then pushed the guide deep, and a guide liner and guide, then pulled the burr, the guide liner, while advancing the 8 French guide. It did work, and it was amazing actually what we saw. The burr apparently chewed a very old stent, or a 3-year-old stent.
Oh, there was a stent there in the lesion. Okay.
Right. Or proximal to the intended lesion, and we got everything out. Then we did IVUS and stented the mid-circ, proximal to mid-circ. We ballooned the distal disease in the left PLV and left PDA. We got great result, and yeah, things went well.
So how you use the wire of the orbital atherectomy device to advance the 8 French guide?
Right, along with J-wire. Along with the J-wire. And that's why, because advancing an 8 French sheath only over that wire is not going to give any support.
Yeah, exactly.
So having a J-wire as well will not allow you to advance the dilator.
Yeah.
So I used this telescope, you know, 6 French guide liner, inside a 6 French guide, inside a cut JR4 guide, inside an 8 French sheath, all over these 2 wires allowed me to do this.
And what wire did you use to wire around the burr?
I used Pilot 200 initially. 200? Yeah, before I upgraded the system. After that, you know, the part of the stent was out. I advanced Pilot 50, then did balloon so that I anchor it, and then advance the guide liner deeper.
And when you said that you saw that the part of the stent on the burr, or on IVUS you saw that?
No, on the burr. We got it actually out. We have very nice pictures of that stent being stuck on the burr, proximal to it, and distal as well.
Oh, nice. Okay. Wow, interesting. Yeah. Well, that's really challenging. Ameko, definitely, this is kind of when the cath lab strikes. So you can watch Dr. Azzam case. It's going to be on CVI website. All the cases are recorded. These challenging cases and the others, but congratulations, well-deserved award to be a finalist for the coronary challenging cases.
Great honor.
Thanks for being with us. Watch these videos and other on the YouTube channel, and also follow the hashtag CVI2018. This is Shadi from Denver, Colorado.